Dear students, today we are here to continue our topic, that is oral antidiabetic drugs. In this session, we will study about few of the oral antidiabetics and their pharmacological actions, their adverse reactions, and their preparations and dose. So let us start with bigonides. Bigonides are the oral antidiabetic drugs. These reduce the blood glucose level. These reduce the blood glucose level like insulin-like effects on the body tissues. They are well absorbed on oral administration. Well absorbed on oral administration. They are well absorbed on oral administration from gastrointestinal tract. Their maximum activity occurs in 4 hours. Maximum activity occurs in 4 hours and are eliminated in the urine. Eliminated in urine within 24 hours. Urine within 24 hours. The prototype of this group of drugs is metformin and fenformin. Metformin and fenformin. They produce their effects by mechanism of action. That means they produce their effects by suppressing. They suppress the hepatic gluconeogenesis. Gluconeogenesis means these groups perform their action by suppressing the hepatic gluconeogenesis. Next, they inhibit the glucose. They inhibit glucose absorption from intestines. And also stimulate peripheral uptake of glucose. Number 3, they perform their action by stimulating peripheral uptake of glucose in tissues. Means they stimulate the peripheral uptake of glucose in tissues in presence of insulin. Now coming to this was about the mechanism of action. Now coming to the adverse effects. Number first, they are unpleasant in taste, bitter, or metallic taste, They are associated with abdominal discomfort. And nausea. Fenformin is observed to have Fenformin causes lactic acidosis. Lactic acidosis is when person overproduces lactic acid in their tissues, due to which they feel lethargy and muscle weakness. So fenformin is not used because of the lactic acidosis. While as in case of metformin, this lactic acidosis is rare. So this was about the adverse reactions of bigonides. Now coming to the preparation and dose. Preparation and dose. Fenformin tablets. Fenformin tablets 25 to 150 milligrams daily. Number 2, metformin. Metformin tablets dose is 500 to 2000 milligrams daily. This was the preparation and dose of bigonides. Next group of drugs is meglitinides. Meglitinides. In this group of drugs we have repaglinide and natiglinide. Natiglinide. This increase the insulin secretion. Increase in insulin secretion. This produce the antidiabetic effect by increasing insulin secretion. These are also rapidly absorbed from the gut and have the same adverse reactions, that is gastrointestinal disturbances. Adverse reactions are gastrointestinal disturbances. Gastrointestinal disturbances. These are used in type 2 diabetes mellitus. Type 2 diabetes mellitus. This was about the meglitinides. Now, next group of drugs is alpha-glucosidase inhibitors. Alpha-glucosidase. Alpha-glucosidase inhibitors. Alpha-glucosidase inhibitors. Alpha-glucosidase are the enzymes which catalyze hydrolysis of starch to simple sugars. So these produce the glucose from intestinal absorption, which causes increase in the blood glucose level. Alpha-glucosidase inhibitors are those drugs which inhibit this glucosidase activity. They competitively bind to the reversibly to the glucosidase enzymes and cause inhibition of the absorption of glucose from the intestinal brush border epithelium. In alpha-glucosidase inhibitors, we have two types of drugs, that is acarbose and maglitol. This acarbose reduce the glucose absorption from the upper intestines and thereby produce antidiabetic effect. Alpha glycosidases do not cause hypoglycemia. No hypoglycemia. They do not cause hypoglycemia effect. However, if used with the other antidiabetics, if hypoglycemia occurs, then glucose should be given instead of sucrose. Glucose should be given because sucrase is also inhibited by alpha glycosidase inhibitors. So in that case, use glucose to avoid hypoglycemia. This was about the oral antidiabetic drugs. For further details, we will continue in next session. Thank you.